Now, Kenya has denied its athletes clearance to compete at the Kilimanjaro Marathon in Tanzania over concerns about the coronavirus pandemic. Tanzania has been criticized for its approach to the pandemic after the country refused to share or update its COVID-19 infection stats since April. In a statement, Athletics Kenya urged all athletes not to travel to Tanzania for this event this Sunday. Kenyan runners have dominated the last three editions of the Kilimanjaro fixture, which takes place in the northern town of Moshi. Last week, President John Magufuli, who has insisted the disease can be defeated with prayer, conceded that it was still circulating, revealing some of his aides and family members had contracted COVID-19 but had recovered. Barnabas Korir is the Athletics Kenya Nairobi region chairman, and he joins us now via Zoom to explain this country's decision and the way forward. Thank you so much indeed for joining us. I would imagine it was a tough decision for you to make, but one you felt was necessary.
Yes, it was a very difficult decision, but we had to make consultation with also quite a number of stakeholders and also the athletes. There's quite a spike in Tanzania on coronavirus, and it was also a decision that is precautionary to ensure that we protect the athletes who go there, and if they come back, they are also going to be in the camps with the other athletes. So it's just a matter of trying to see if we can actually try to protect also the spread of the coronavirus in some areas which had already gone down.
How do you know about the spike in the COVID-19 situation in Tanzania? The country, as far as we know, is not reporting any figures at all.
In the last 1 week, we have seen also news, both locally and internationally, concerning the issue of the coronavirus in Tanzania. We saw also the death of the vice president from Zanzibar. We also saw the president of Tanzania talking about it, and also getting concerned. And as you have said it, that he was also saying that the Tanzanian people should continue praying. But practically, we took measures. The president of the Republic of Kenya took stringent measures to try to mitigate the spread of the disease, and we were quite successful in reducing the spread of the disease. So we are also trying to take strong measures to ensure that at least it is not that it is no longer in Kenya, but we are also trying to reduce the chances of spreading again. So there are measures that we still have in Kenya, and those ones now the government of Kenya introduced resumption of sports activities in the country, and we were given regulations and guidelines to follow and to ensure that before we do anything, we have to observe those regulations given by the Ministry of Health and the government of Kenya.
Talking about regulations, I mean, there are countries that say once you've been away and you come back, one of the things that you can do is quarantine for a period of time. Might that not have been an option for athletes returning from Tanzania?
Of course, that could have been one of the cases. Before they leave the country, they have to be tested. They have to have a certificate also before their departure. But when they come back also, and there are quite a number of them, many athletes will go to Tanzania. So it might be very difficult to follow that rules. And most of them, they travel by road. And then when they come back, it is very difficult also to follow them in the areas they are traveling to. And before even some measures is taken, maybe they come in contact with their relatives or at least they are training with together. So the best way is at least to at least stop them from competing for the time being. It is only one race that we want to see how far it goes, and until now we wait for the government to give guidelines on how we can continue resuming sports, especially with the neighboring country of Tanzania.
How have the athletes reacted, particularly the ones that compete at a high level? Have they been understanding?
Of course, this morning, yesterday and this morning also, I had an opportunity to have a discussion with them. We called them, we had a meeting and gave them the explanations of why this has happened, and what the federation is doing is to protect also, to give them protection, to assist them in making decisions on areas where they might have any problem. So the ones we had a discussion yesterday and this morning, they understood because the explanation was very clear to them, and they know also the decision that has been taken is for their own good. So I think those who have had contact, they have no problem. The only issue now is we have some athletes already who have traveled to Tanzania. And this afternoon, we had also discussions with the Vice President of Athletics Tanzania, and we explained to them the reasons why the athletes were not allowed to compete, and they understood. And tomorrow also, we'll still continue discussing. We want also to make sure that we get in touch with them, those who are going to run. And we don't want to create a situation where in the future, Kenyan athletes will be denied to go to Tanzania, as we are expecting some of them also from Tanzania to come to Kenya for the relays. So we want to have a balance where there is no conflict with us and Tanzania, and especially at least Tanzania. And I'm sure that they'll be understanding as we continue trying to help each other as federations.
This is quite a big race. I'm not sure if you know the answer to this, but how many other countries typically go and compete in this event?
Yes, we have, in fact, the largest number of athletes that take part in this race come from Kenya. There are actually many, and I understand also some athletes from Tanzania, from Uganda, from Ethiopia, and other countries from Europe. Especially Germany, they come and compete. We have also non-competitive athletes. They run for fun. They are also coming from other countries. So this is a big race. And we also have been able to try to encourage them, because we need a regional race, a big race within East African region that will also attract quite a number of athletes. And the prize money that is given to athletes also is substantial. That is something that we wanted also to make sure that most of the winners will always be Kenyans, and they bring some money back to their families. So I think in one way or the other, the discussion revolves around the health of the individual, the health of the athletes, and also the life is more important than now going for the money issues. So at least if you don't get affected, you remain healthy, you have another chance to compete. If you are affected and you have problems, later on you might not be able to compete again. So this is a situation where we all have to understand, and I'm sure that is not a permanent solution. We are going to have other competitions in the future.
How many Kenyans do you think would have likely gone to compete in this race?
So far, from my understanding, after discussion with John Bayer from the Vice President of Athletics Tanzania, I was informed that there were 15 athletes already who are in Tanzania. Today, we had 10 who wanted to go. Yesterday, we had 5. So I would say in the region of 50 Kenyan athletes who could have competed in Tanzania.
So what is the state of Kenya's athletics at this moment in time? Is activity back? Are people training in isolation? What is the state of play?
Yes, there's the activity is going on. We have a competition this weekend. One of the weekend meetings, we normally have a 2-day meeting in Nairobi. The competition is going on under guidance from the government regulations that were given. We have protocols that will be observed during the competition. We have also doctors who will be there, and we try as much as possible to give the distance. Of course, in Kenya, we have these contact sports and non-contact sports. Athletics is considered non-contact. And remember, this year is also an Olympic year. So we have athletes preparing. We have selected a team of marathoners, of both men and women, that will be participating. Next week, we will start a purple training program that will be held in Kasarani National Stadium. Athletes will be staying there, both athletics and also rugby, basketball and volleyball, that will be taking part during the Olympics. So the activities is going on. Unfortunately, yesterday we had Confederation of African Athletics cross-country that could have taken place in Lome, Toko. It was cancelled. and our team that had already been selected was in a training camp in part of Eastern Kenya. So those are the issues that we are facing, uncertainty as far as athletics in other countries. But in Kenya, we keep on moving. We have had competition about 3 weeks ago for the National Cross Country Championship that was successful held in Nairobi here. There were no incidents after that. We have not had any infections or any spread of the COVID-19. So at least in Kenya, it is under control.
And what sort of protocols are you undertaking, particularly with these upcoming events? Are athletes put in bubbles? Are they tested regularly? How are you making sure that the games are safe?
What is happening is that most athletes that will be coming or competing will have come from the camps. We have the protocols that have been set up. In every camp, they have the testing protocols before they travel. They are tested. They have also sanitizers at every camp, and also some from schools. The regulations are very stringent in the schools also, because we have at least that come from both primary and secondary schools. So those protocols are there. And of course, when they come to the competition area, we have medical personnel and COVID-19 officials that have already been selected. And they're there within the stadium or the area where they're going to stage the event. They cover everything and ensure that officials also that are manning the event observing the protocols that have been given. So at least I would say that it is actually quite safe for most of the athletes that are coming to compete. So far, we continued since last year, and we have not had major problems as far as the spread of the COVID-19 within the athletic fraternity has occurred. So we are at least safe for now, and we hope to maintain that level of awareness and ensure that as we move forward, we continue reducing or controlling the spread of the disease within the athletic family.
All right, and perhaps finally, looking ahead, what is Kenya's position in terms of the Summer Olympic Games? What do you know in terms of whether they're going ahead, and will Kenya be sending a team?
Absolutely. What we are hoping is that the Olympics will go on, and we have seen or received the information from Tokyo Olympics organizers. They say that the event will continue, will go ahead. We are preparing ourselves along those lines. If nothing happens from Tokyo, we are going to send a team to Tokyo. We are ready, and we are following all the rules, protocols given by the Olympic organizers, and we have received all the regulations, requirements that has to be done before going there, the officials and athletes, and also other technical officials that will be accompanying the team. We will observe all those rules, and if the event goes ahead as it is planned, Kenya will send a team.
Does that include athletes being vaccinated?
We are not aware of that. That is one of the requirements. If it comes to that, definitely, then the athletes will follow those regulations. But as of now, we have not seen a requirement that athletes should be vaccinated. But of course, the requirement is that they have to be tested and have a certificate to show that they have been tested. But it will be done regularly. It is given 2-week period that they have to be tested in every fortnight. So those ones will be followed. As for the vaccine, we have not received any guidelines on that.
All right, and that's where we'll leave it. Thank you so much indeed for joining us and sharing your thoughts with us and giving us your time. I know it's very late in the evening there, so we appreciate your time with this evening. Asante sana.
Thank you very much, and good night.
Good night.